Hi, I'm Alexis, and today we were talking about agoraphobia, which is the fear of spaces and crowds. So some of the common fears that go along with agoraphobia would be social phobia, which is the fear of being watched and or negatively judged by others. You have your generalized anxiety disorder, which is the fear of constantly being overwhelmed or overstimulated. And then you have your specific phobias, when something makes you feel so intensely feared, it disrupts your everyday life. So agoraphobia can also come into play with everyday anxiety, claustrophobia, which is the fear of being in a tight space and not being able to get out. It is a genetically imbalance of the chemicals in your brain. So yes, as this is a fear, it is an anxiety-based fear. So there are medications and treatment options for this fear. It also comes into play with environmental factors. So as these things like going into large crowds, what it triggers you environmentally is what leads into having these attacks. So some of the triggers are large open crowds, the open spaces, places outside of your home or your comfort area, and public transportation, as these are all places that make it hard to get out in case there's something happens. The fear of having so many people around you and judging you for whatever reason. And then some of your signs would be rapid heart rate, chest pain, loss of control, and the fear of dying, which are all symptoms of an anxiety attack. There are treatment options for this fear, as it is an anxiety-led fear. You have medications such as an anti-anxiety medication that will help tend to those anxiety symptoms. You have counseling and talk therapy, which would be talking to somebody about what triggers these fears and then giving you some type of way to help, let's say, reduce the effects of an anxiety attack or what to do in case of an anxiety attack. There's support groups, so people who are also going through it, the same thing as you are, there's groups to talk to and get feedback on how they tend to deal with things and get different ideas, and also to let you know you're not the only person with this fear. There's multiple other people going through it. And then after you talk to a therapist, they'll give you instructions and self-help methods. So what to do if you feel an anxiety attack coming on, how to go about introducing yourself to these new spaces that you tend to have anxiety attacks in. So how to overcome. You can create an anxiety plan with your therapist, with your friends, family, whoever, and have a good support system and that encourage you. So your mom, your dad, your husband, your wife, whoever it is, have them able to encourage you into going into these environments, or how to support you in case you are in public and you have an attack, and to educate yourself as an outsider looking in on how to help somebody with this fear. So the reflection, the call of action, to recognize that you have this condition and that you do need help, whether that's getting on medication, seeking a therapist, any type of help that you can get, and slowly expose yourself to these feared situations. So whether that is having somebody come with you to these certain places to help you in case you had an attack, going into a parking lot of a store just to get your foot in the water to kind of slowly expose yourself to getting back into your daily routine. This fear prohibits progress from holding people back from future opportunities, like a job or going on vacations. With a job, if it's at a mall or a place that is heavily crowded with people, the fear of being constantly judged and watched, that leads into play with that. So that might stop somebody from seeking a job, a vacation, if they have that fear of transportation and not being able to escape quickly if need be. If you're going on a vacation that required you getting on a plane, the fear of getting on that plane and being in the airport with a lot of people around you will stop you from going on vacations and doing things that you might enjoy. And it secludes you from the outside world. So people with this tend to stay home or in areas that they are comfortable with rather than venturing out and doing new things just because they don't know what the environment's like. And it makes your everyday tasks more difficult, like grocery shopping, just get things that you need because it's a new environment that you're not comfortable with, or it's an environment that you know is going to lead to an attack, so you tend to stay away from it. And that's all I have for y'all today. Thank you so much for listening.